Now we would like to request Dr. Sharad Kumar Agrawal and Dr. Deepak Puri and Dr. Chetan Khurana, Mohammad Hazruddin Farooqi, Dr. Farheen Khan, please come. Please, ma'am, come for lamp lighting. I request to all, please give a big round of applause for all the chief guests. Thank you so much, everyone. Now I request to Dr. Farheen Khan, CEO, founder, and CFO, Golden Aim Brand Ambassador Asia, GCC. Dr. Farheen Khan, ma'am, please come up on a stage for opening remark. Come on, everyone, give a big round of applause.
Good morning, everyone. I welcome you all to the Golden Aim Conference and Award for the Excellence and Leadership. This is Dr. Farheen Khan, co-founder and CFO, Golden Aim and chairperson, Asia GCC Conclave. I would like to take this opportunity to thank and great warm welcome to all the participants, the speakers, and other guests for gracing this occasion. The objective of the award is to recognize and felicitate the healthcare and the education professionals who have demonstrated outstanding contribution in their respective field. We are running into the 21st century where technologies have no boundaries. During this phase, the education system is evolving for the sake of settlement. Digitalizations no doubt change our education system, but we cannot say it has been diminished the value of old time where we used to learn in the classroom. The best part about the digitalization in education is in the 21st century is the combination with the both aspects of classroom learning and online learning. And in today's world, education is very important for personal and socio-economic development of our country. While on the other hand, the healthcare professionals who are considered one of the most important part of our society, and the education profession and the healthcare profession is one of the noblest profession, and doctors are considered next to the God. The medical professionals have evolved into the centuries, and it is still evolving. This has been more influenced by the COVID-19 pandemic. In this today, and this is a day to acknowledge and recognize and salute and pay tribute to all the selfless and unconditional services that has been rendered by the medical fraternity, particularly the frontline healthcare workers who had placed their life to risk. It's a perfect day for doctors to stand a still community and rebuild a lost trust. The contribution of hard work of both education and healthcare professionals deserve a gratitude each and every day. And today, I'm very pleased to connect with all the dignitaries present in this room. I would not take much of your time, end by a beautiful quote that transforming is not the technology, it's the technology that is transforming you. Thank you, everyone.
Thank you so much, ma'am. Now I request to Mohammad Azruddin Farooqi, CEO and CEO founder, Dynegic Business and Solution. Please come up on a stage and say a few words, sir. Come on, everyone.
Hello. Good morning to everyone. I, Azharuddin Farooqi, the co-founder and CFO of Dinergic Business Solutions, and I am the Managing Director of Pharma Global Management Services. On behalf of my entire team, I would sincerely acknowledge the effort of those who come forward and contribute towards the success of this event and make this grand. My company, Dinergic Business Solutions, we provided solutions in various segments and sectors. We are in the manufacturing industry, and we heavily depend on the garment manufacturing. Over the 700 employees working in the manufacturing unit. We are in the healthcare business. We are in the electronic business. We provided complete electronic solutions internationally and nationally. And we started our chain in fitness academies also. We started our business in 2004 with a small warehouse in Mumbai, and now with the team support, we build our chain national to international level. Nationally, we have in the Mumbai, Pune, Delhi, Bengaluru, West Bengal, and internationally, we are in the Dubai, Oman, and Indonesia. And I hope to build more chain in future. And I'm very thankful to Golden Aim Conference and Awards to give us a chance to be a partner of this prestigious event where the thought leaders and professionals share their views and knowledge. And thank you so much for the event, and best of luck for the day. Thank you so much.
Thank you so much, sir. Now I request to Dr. Sharad Kumar Agrawal, National President, IMA. Sir, please come up on a stage and say a few words.
Thank you. Can you just run the presentation? Hi, friends. I don't know how many of you are the members of Indian Medical Association. So it's good to see that Indian Medical Association is the largest association in the world. It's have almost 4 lakh members of this association. And through its 1750 branches, we are present in across the country. Each and every district there is a Indian Medical Association. And through Indian Medical Association, we do a lot of work which is focused for the work towards the society. Our aim is, the first aim is to upliftment of the society, the citizen of country. Second is upgrading our knowledge by the medium of continuous medical education. And third is definitely to voice upon whenever there is any issue related to our profession. Change. So IMA is doing lot of social work like the Aao Gaon Chale program. This Aao Gaon Chale program we have launched in 2004, and through this program we asked all the branches, 1750 branches, to adopt at least one village and do continuous activity there, regular activities related to anemia detection, the iron deficiency, vaccination, day-to-day do's and don't about any disease. So we work towards the preventive part of this, the program in the community. And it is a regular activities, and all the branches, they submit the reports to the headquarter. COVID management, everybody knows what is the role of IMA. When the world was suffering and WHO has appreciated the management of India, it is all because of our doctors and our healthcare workers. Through IMA, we ensure that minimum mortality should be there. And we were there on the road when everybody was afraid, fearing. They were in the house. Even the relatives are not touching the relative. It is the members of Indian Medical Association and the healthcare workers who were working day and night, risking their lives. And IMA lost more than 2,000 doctors during servicing the COVID. But we are proud that we could do and we could prove our mettle. And the world seen what the contribution of Indian Medical Association. And this is, we are celebrating our centenary in 2028. So you can understand that the biggest organization which is there for almost 100 years. It is not an easy job for any association to be the largest and sustaining for 100 years. And for decade, IMA is doing maximum activity for the society. The only thing probably we don't know. The blood donation camp, those who are the member of IMA, they all know that we celebrated the Doctors' Day, and we do on the 1st October also. We do organize blood donation camp across the country and help the society. The tuberculosis control program, everybody knows when the DOT strategy came, it was only the IMA who helped the government. Without IMA, government couldn't even think of to putting that DOT strategy. Because through the network of Indian Medical Association, we trained almost 2.5 lakh doctors in the country for the DOT strategy. And that is how the TB program get the momentum. And because of the IMA efforts, government is thinking now to eliminate it by 2025. So that is again the hard work of the members of Indian Medical Association. Save the Girl Child, Save Motherhood, Stop Sex Selection. These are the very sensitive projects which IMA took proactively. We made a campaign that there should not be any sex selection. We gave the slogan, before government gave the slogan, Save the Girl Child. So these are the community projects. I am highlighting the very few. Recently on the International Women's Day, on the 8th March, we have released a movie on the examination of the survival of sexual assaults and rape. Because after the recent Supreme Court guideline that they have abolished the two-finger test, we have presented how to do the examination. And we have presented it to almost 45 medical colleges also. We have given in association with the Child and Women Health Ministry. We have prepared this video and we launch it on 8th of March on Holy Day. And we have presented it to the 45 medical colleges also, and we have suggested the government to include these all subjects in a undergraduate curriculum. And it should be in a part of the pediatrics curriculum and the forensic medicine curriculum, so that doctors should know how to examine. Because it is very important to have a proper medical examination, to have the sufficient evidence to make the culprit behind the bar. So if we know how to examine, how to get the samples and how to make the evidences, then only the justice can be done. So this is again our project. And you can see even the day of Holi, when the entire country is celebrating, IMA is working. Antimicrobial resistance, all the doctors, they know, this is the biggest global challenge nowadays. The Stewart syndrome is the biggest problem. And in the coming year, you will see that is the biggest, this is the topmost problem of the medical field. So through IMA, we are also sensitizing our doctor the rational use of antibiotics. And time to time, we are organizing Zoom platform meetings with our doctors to sensitize them that only and only prescribe antibiotic where it is required. Because as we see in a COVID infection, invariably people are using antibiotic. There is no role of antibiotic unless until there is a superadded infection. But there is nothing like that we are adding precautionary antibiotic. There is nothing like no role of antibiotic. So we are doing all this sensitization not for the public also, but also our doctors where it required. Polio eradication, you all know, won't be possible without the help of Indian Medical Association. Because if you remember 10 or 15 years before, when government has to organize the polio vaccination camp, our all doctors, they used to organize the camp in their clinic or their hospital to add the target of the government. Because unless until IMA has participated, we would not be able to complete our target and reach that level to have that polio free. So again, this is the contribution of Indian Medical Association to building the nation. HIV control, we all know. In the late 90s, when nobody was aware how to do with this disease, and even the doctors were scared to touch the patient, we did this sensitization program in across country, and we have done thousands of sensitization program, and through our HIV/AIDS sensitization program, we sensitize our doctors community, and that is why we are here now. These are a few another initiative like Safe Sound. We were the one who presented the central government that what should be the decibel in the marriage, in the parties, or in the procession. Then only they bring into the, they have made the law on this. The organ donation, we are having this committee for sensitizing and for making the awareness for the organ donations. Because particularly in a kidney disease, we have seen there is a huge gap. The requirement is almost per year is around 7 lakh of the organ donation, and we hardly have less than lakh. So there is a huge gap, and the organs are available. The only thing is the awareness is not there. The system is not there. IMA is working on that so that we can meet out that demand and we can fill up that gap. Road safety awareness is a continuous program, and these are the few programs you can see the IMA is running. The blood donation, the improvement of medical education, for the food safety, for the prevention of diabetic retinopathy, for detection of the congenital deafness, for emotional health and emotional well-being, for the medical student. That is also a biggest problem starting now, that lot of suicidal cases are reporting in the medical colleges. A committee for the organ donation, as I said, the initiative for the sexual health, which is again very important topic, national initiative for Safe Sound, for the tribal health, for the antimicrobial resistance, for medical ethics, promotion and implementation of vaccination. We all see the success of our COVID vaccination. Again, the contribution of the IMA, proactive contribution of Indian Medical Association. For the rural health, as I said, we have our beloved project by name of Aao Gaon Chale. Tobacco control, men's health, pharmacovigilance again is a new thing for the doctors. Probably those who have went to the NABH, they might have come across that the NABH people are asking you to join the pharmacovigilance. That is also IMA is taking care of that. Non-communicable disease is again a biggest problem in India. Because 20 years before, this is the problem of the Western world. But now this NCD is the biggest problem in India. So we have the committee for working on this, suggesting the government as well as to the society. Initiative of Safe Motherhood, COVID Martyr Fund. When there was a COVID, all the government, they have announced so many lucrative offers, but hardly they have done anything. We have lost 2,000 members, family. Government till now didn't do anything for those. It is only the IMA. IMA started made a COVID mortar fund, and we have supported with 10 lakh to each the family who have lost their doctors. Though we have we have their eligibility form. Basically, we have supported those family who are very unstable stage. Like doctor is very young, 30-year, 35-year, has a small children. So we have supported them by giving 10 lakh rupees. Epidemic disease, NTV initiative, child health, committee for stroke and hypertension control, resuscitation CPR. Through this resuscitation committee, we have trained lakhs of police personnel and the active, the healthcare workers across the country. Because again, this CPR has a very good role. Lot of emergency which required a immediate intervention to save the life. If the people on the country, they know at least the basic life support, we can save a lot of life. To send them in a good condition to the hospital so that the intervention can be done. Otherwise, what happened in the cardiac arrest? Most of the people, they lost life during transit. So we have trained lot of police personnel and the healthcare workers on this. Committee for Disaster Management, Care for Elderly Wing, Mission Pink Health, Patient Charter Protection Cell, Violence Against Health Professionals, Health Policy Committee, Primary Health Care, Secondary and Tertiary Health Care Committee, Communicable Disease Committee, Save the Girl Child Committee. Through IMA, we have started helping the small hospital to getting the NABH accreditation. So those hospitals who are the member of Indian Medical Association and they are applying through IMA, they are getting a support from IMA and they have very good success rate getting the NABH. So they don't have to, lot of complaints are there that the NABH pupil, probably they are not comfortable, they are behaving like inspector. So at the same time, we have also discussed with the NABH that they should not they should also train their the trainers and the inspector and the whoever are going there for the inspections. Biomedical Waste Management Committee, Road Safety Committee, for the public health. And we always volunteer to the government that we are there to support the government. We are no one like a opposite party to criticize government everywhere. But yes, whenever there is an issue affecting the modern medicine, IMA will be there, irrespective of all the party politics. Whichever the government, if government is trying to compress or pressurize the profession, IMA is there to fight. I request all the members who are sitting here, they should follow the Indian Medical Association on the YouTube channel and the Facebook, because you can get a lot of information through that. And those who are using the Twitter, they please retweet the IMA tweets, because every day there is a tweet from the IMA headquarters. With all these words, thank you very much, and I give my best wishes to the organizers for their forthcoming program. Thank you. Long live IMA.
Sir, thank you so much, and I request to once again Dr. Sharad Kumar Agrawal, sir, please come up on a stage once. And I request to Dr. Fareen Khan and Mohammad Azruddin Farooqi, sir, please come up on a stage to present thank you memento. Thank you so much, sir. Sir, please stay. Ma'am, please. Now it's time to award ceremony. Education. The first category. First to education. The first category of the awards, award for the excellence and the leadership in the healthcare. I request to Dr. Sharad Kumar sir, please come up on a stage for the present award. The first award, Iconic Business Leadership Award, goes to Mr. Shrendra Dung. Please, sir, come up on a stage. And everyone, I request to you, please give a big round of applause for Mr. Sharad Dung, Global President, Commercial and... Congratulations, sir. Thank you so much. Next category, Quality Healthcare Leadership Award, goes to Dr. Nishant Mittal. Come on, everyone, give a big round of applause for Dr. Nishant Mittal. Congratulations, sir. The next category, Iconic Healthcare. Sir, I request to you, please say few words. Please, sir. I request to you, please say few words.
First of all, I would like to thank the jury for selecting Dr. Nishant Mittal. He's my son. He's a very dynamic neurologist. He has done his MBA from MAMC, gold medalist from KLE, and doing a beautiful work in Sonipat. Normally, these awards go to metropolitans, big people. I do not know how the jury has selected a common person doing excellent work. He is doing excellent work. He is not able to come. I am receiving this award on his behalf because he is busy with some critical patients. This encourages the confidence of working if at the beginning talent is recognized. I am thankful to the jury. I am thankful to all of you to receive this award in presence of you all. Thank you so much.
Thank you so much, sir. Next category is Iconic Healthcare Leadership Award, goes to Dr. Narendra Kumar Mittal. Come on, everyone. Okay.
I am a pediatrician at Sonipat, working for last 40 years, almost 40 years. And what Dr. Sharad Agrawal has said, "Aao gaon chale." My motto is, let us move ahead. I'm a very core worker of IMA and IAP. Professor Kamal Bakshi is sitting in front of me. I know her for last so many years. She's a symbol of commitment, and I try to embolize her hard work, sincerity, dedication, and real commitment to the profession. Thank you so much.
Congratulations, sir. Next category, Best Leadership in Medical Education Award, goes to Dr. Gautam Ghose. Come on, everyone, give a big round of applause for Mr. Gautam Ghose. Congratulations, sir. Okay. Thank you so much, sir. Next category award, Outstanding Contribution in the Field of Healthcare, IVF Specialist, Professor Dr. Abha Majumdar. Please, ma'am. It's not, okay. The next category award goes to Iconic Healthcare Leadership Award, Professor Ashla Batra. Okay, ma'am, on the way. Next category award goes to Iconic Healthcare Leadership Award, Dr. Jogendra Singh Dhankar. Sir, come on everyone, give a big round of applause for Mr. Jogendra Singh Dhankar. Congratulations, sir. The next category, Women Super Achiever Award, goes to Dr. Chandra Lekha Tuladhar. Congratulations, ma'am. Congratulations, ma'am, and I request to you, please say a few words.
Good morning, everybody. I am really grateful to Global AIM Award Committee for choosing me for this prestigious recognition. I don't know how much you'll believe me if I say it came as a big surprise to me. I had no clue at all, but I felt that it was God's blessing and the blessing of this committee and all the people here. Because I had just returned from a screening camp of neurological condition of children to identify cerebral palsy in a rural area among the most indigenous and backward community called Chepang. And well, I was very much happy and satisfied with my involvement, and I felt that this was God sent. And it has recharged me to continue my effort there. I'm a graduate of Lady Hardinge Medical College in '72. I feel very much for Delhi, and Delhi has been my home, and my husband has been visiting here, and we have been frequenting this place for the last 60 years. And I read through all the thing of the Medical Council, and congratulations to you for maintaining all these and it's very much to my heart. It's everything that we have learned and we are replicating, whether be it through medical as a professional or as a volunteer, because selfless service is my mission. And even outside of medical, I'm more for education, because I feel one is the right arm, the other left. Without education, we cannot emphasize on the health of the community. And initially, service was to the family, extended family, etc. But then going out to the community has given greater satisfaction and meaning to the life of service. And that is not enough, because now I'm going to the last phase of my life. How long will I be there? So energizing the youth is another great mission. And even the youngsters, just before I came here, my grandson was packing the dental kit donated by my granddaughter, who is only 17. She generated the fund, and he said, I want to earn. I said, what do you want to earn for? He's saying, I want to donate. And I said, yeah, how much? He's saying 80%. I said, 80%? He's saying, is that too much? Well, I couldn't disappoint him. I said, very happy. I didn't think he would carry it out. But 2 days later, he has his birthday, and he gave me 2,000. So developing this empathy and compassion of the young children from young, because that's what my mother did, and I take them along to all these service areas that I go to, and that's how I believe we can help in giving continuity. The one small thing I would like to remark, I don't know how it is here, but I saw a thing about the sexual abuse and about gender. We feel very proud. I'm a lady, okay, I feel proud. Gender, female, should be given prominence in everything. But lately, I said, that's not true. We should also empower the men. Because if these men do not get empowered, they become lazy and they become a burden to the lady. So indirectly, we'll be relieving the lady if we empower them. When I said this to my group of friends, the ladies were up in arms. No, I said the time has come. We should not empower the women to such an extent that the men folk become useless. So please, I think a time has come when we have to make a balance, sir, if I may say so. I think that is all I would like to add. Before going, that's all I would like to add. And besides, I'm not a city person. We come from a very remote, my grandparents, my father is from Muktinath. All of you know Muktinath, where that area is. That is called Tukche village, Mustang district, which in our time would take about 2 to 3 weeks to travel. But even then, they educated us, and they believed in making us doctors. So we are paying back. So education will make the difference. So whether be a doctor, engineer, whatever. So if you do not have education, you are back to square one. Okay, thank you so much.
Thank you so much, ma'am. The next category of award, Most Trusted Cardiothoracic Award, goes to Dr. Deepak Puri. Come on, everyone, give a big round of applause for Deepak Puri. Congratulations, sir. Congratulations, sir. I request to you, sir, please say a few words.
Thank you very much, Golden Aim Awards. Thank you, the organizers, Mr. Faruqi and Dr. Fareen, and thank you, Dr. Sharath. I would reinforce that medicine and education is still the noblest of all professions. And today, I have to make a presentation also here, which is briefly going to make everyone aware, and it is a kind of an appeal that all of us need to join hands if we want to improve the healthcare of the society. Because it is not only the responsibility of a particular doctor or particular specialty or particular type of medicine. We should not compete with each other. We should come together as a team to deliver what would be in future the best comprehensive delivery of healthcare. So I request you all to please listen to the small talk and also join hands with me from today so that we can improve the healthcare to a great extent. Thank you.
Thank you so much, sir. Now, next category award, Most Trusted Healthcare Leadership Award, goes to Dr. Samita Gupta. I request to each one of you, please give a big round of Dr. Samita Gupta. Congratulations, ma'am. Ma'am, would you like to share your opinion or your journey?
Hello everyone. I would like to pay my heartiest thanks to Golden Aim Awards, Dynergic Business Solutions, Ajwar Faruqi sir, Farheen Khan ma'am, Sharad sir, and all special guests. I'm a pediatrician by profession, and I'm on a mission to save 1 million sick children of India. And this kind of encouragement, I think, is very valuable in the journey of my vision. Thank you so much.
Thank you, ma'am. Next category of award, Most Trusted Knee and Hip Surgeon in Delhi, Dr. Professor Anil Arora. Come on, everyone, give a big round of applause for Dr. Anil Arora. Maybe he's not here. The next category, Most Trusted Urologist in Delhi, Professor Dr. Rajiv Sood. Come on, everyone, give a big round of applause for Dr. Rajiv Sood. Congratulations, sir.
Thank you very much for this Golden Aim Awards and this Education Award ceremony. I am actually delighted to see Dr. Sharad Agarwal. He is the leader and president of the largest medical fraternity society of India and world. I think 3 to 4 lakh members are there, and to receive honors in his hands is really great. I am a urologist, transplant surgeon. I founded the Department of Urology and Transplant. I founded the Atal Bihari Vajpayee Institute of Medical Sciences. This is the contribution. For that, I got the National VC Rai Award once. And now, with the IMA, I had a long association. I started few years back the men's health issues, and I led that. Global conferences were done, and last year we had a great conference, international conference on men's health. And you know 50% of population we say is women, but 50% is male. And it is to share with you, men suffer more and die early as far as disease is concerned. We live 5 years shorter than women. And there are reasons for that, and those reasons are to be explored. And IMA had 2 years back given us a responsibility. We have created the guidelines for men's health, and now we are working on the 3rd version of the guidelines, and very soon we will be inviting you all, and under the leadership of Dr. Sharad Agarwal, we has great hopes that a new specialty of men's health will grow. I am a urologist. Andrology and men's health is greatly covered under urology, and therefore, and also reproductive and IVF and all. We are all associated. Actually, urology is one discipline where we associate with many of the super specialty and subspecialties. So, all the congratulations for this great thought and gathering. Thank you very much, sir. Again, thank you.
Thank you so much, sir. Thank you, sir. Thank you so much, sir. Sir, just a minute, sir. Sorry, but please, 2 more awards, please. The next award, Most Trusted Healthcare Leadership Award, goes to Dr. Rajiv Kumar Mittal. Sir, congratulations, sir. The next award, Excellence in the Field of Medical, Dr. Ajay Gugyai. Mr. Dr. Ajay, please. Next category, the most dynamic woman healthcare leadership award goes to Dr. Tanya. Congratulations, ma'am. Ma'am, would you like to say something?
A very good afternoon now, and thank you very much for having me here. I truly appreciate the award that has been given, and having such wonderful predecessors receive the award makes me truly, truly humbled. I would also just found out that Sir was there with the Max institutions and helped set it up. I am from Max in Delhi, but I'm from Lady Harding, and having ma'am say, it was such an honor, ma'am, and I completely resonate with your thoughts. And IVF, infertility, and reproductive medicine are my forte. But also, sir, another area where I think, two areas really, is to work on the fertility and cancer survivors. So that's something we're building up, and almost 13 years ago, I started that department at Max Hospitals, and I think that's another area where a lot of our survivors are reaching the age where they can lead a healthy life. Early detection means that we want them to have a long life. And for every woman and for every man, the fact that you can have children with your own gametes is truly the most inane desire that they can have. And I think if we work on that, raise the awareness, educate, and give them the resources and the facilities, then I think that's another thing, which we can encompass with the IMA. Absolutely, sir. So if we make it with especially the fertility and cancer survivors and reach out beyond the metropolitans, because I think that is something even, if you're looking at the level 2, level 3 cities, that would be wonderful. And I'm so happy sir talked about men's health, and I think another thing we all as doctors need to do is work our own selves. We need to work on our mind, we need to work on our bodies. The healthier we are, the happier we are, the better doctors we become, and the better health professionals we are. Thank you very much.
I request everyone those are not the member of IMA. Are you a member of IMA?
Yes, sir, yeah. Absolutely.
So they should become a member of IMA.
Yes.
And whoever want to start anything or want to contribute in IMA, I am available at IMA office. It is at ITO.
Yes,
so you can come anytime, and you can have my number and you can talk to me. Whoever want to work for the society, we are ready.
Thank you.
Thank you so much, ma'am. The next category, Outstanding Contribution in the Field of Healthcare IVF Specialist, award goes to Professor Dr. Abha Majumdar. Congratulations, ma'am, and I request to all of you, please give a big round of applause for Professor Dr. Abha Majumdar.
what it is with the ethics. And I think all of us know that here we are learning from great teachers. So you stand out giving good students. And I think such an honor, ma'am, to be here and to be actually looking at you at the same time, because I know if someone who stands strong and puts forward the message of education and ethical medical practice, it's ma'am.
Thank you, humble Tanya, for all these nice words. It was very unexpected to find you here also, and I'm so happy that we are sharing the same stage. Dr. Agarwal, I'm extremely thankful to the organizers, the Golden Aim founder, the co-founder, everyone to having me called for the second time. I think the first award I received was when the meeting was on Zoom in COVID days, and it was a surprise, a very pleasant surprise for me to be here. And yes, Tanya, is true that we started the ball rolling for IVF in northern India, had our first baby in 1991. However, IVF has been splashed very badly because probably of surrogacy getting a very sort of a mixed name in our country, but IVF is not surrogacy. Surrogacy is maybe a 0.1 sector of IVF. So many couples require IVF in our country, and I'm very happy that people have sort of stopped thinking as IVF as a taboo. They accept that IVF children are like normal children. They come forward, they sort of tell the society that this baby is born by IVF, and they enjoy the pleasure of parenthood on account of having been treated by IVF. And there are specialists like Tanya sitting here and so many more who have emerged in northern India who do very good ethical practice, give the joy of parenthood to so many couples who require it. And we all stand joined together to take this forward in our country, which has really, really emerged in a very, very big way. The small part of surrogacy which has taken our science backwards only because of the commercial part associated with it. I would want you all to look at IVF with a more open eye, with a wider vision, to see what it is giving to childless couples, and maybe surrogacy also to those couples who really require it. Don't look at the side where people have misused it only because they wanted to keep themselves safe, but to the side where women really needed it. Thank you very much for giving me this award and giving me an opportunity to speak also.
Thank you so much, ma'am. Thank you, sir. Now I request our next speaker, Dr. Deepak Puri, sir. Please come up on a stage for your presentation, sir, please. And now I request to all of you, please give a big welcome.
Very good morning, everyone. I am Dr. Deepak Puri. I am the founder chairman of Cardiomergen, which is a global trust. And the aim of this trust is to integrate all the specialties and to deliver comprehensive management of cardiovascular as well as other lifestyle diseases. Because nowadays, in the coming era, we are going to work as a team. It's no longer a job of a single person to deliver healthcare to everybody. So the concept came into my mind in 2011 when I floated this Cardiomergen, and we held a global conference in which people from 22 countries, they participated. And there were 46 reputed speakers from across the globe, and there were 55 speakers from India, And for the first time, we held the global conference on comprehensive management. And thereafter, people were so excited about the concept that they requested me to continue to hold the conferences every year. And then subsequently in 2013, we held in Orlando in Florida on cardiac emergencies. And then we held 3 times in Japan, in Tokyo, Obihiro, and Okayama. And then we held in Singapore 2 times, in Dubai. And every year we are holding in different countries. And at the same time, we keep on holding conferences regularly in India, in our region. Anywhere, wherever we are invited, we go and we talk on this comprehensive management. So to begin my talk, I will show you a small video. And I hope you like this video. I made a small movie on why the youngsters nowadays, they are getting heart attacks. And I was lucky that my movie was selected for international film festivals, 2 international film festivals, and I won the Best Director award for this.
क्या करूँगा मैं, इतना स्ट्रेस हो रखा है, मेरे पेन हो रही है, मुझे नोजी हो रहा है, घबराहट हो रही है।
हिंग की गोली ठीक तो रहेगी ना इनके लिए?
हिंग की गोली छोड़ो, डॉक्टर को फोन करो, डॉक्टर को।
अगर 1 घंटे से लेट हो गए तो इनकी आर्टरी नहीं खुली तो बहुत जान को खतरा हो सकता है।
3 वेसल डिजीज़ आई है, पेशेंट भी हीमोडायनेमिकली स्टेबल नहीं है, तो उसके लिए इमीडिएट बाईपास सर्जरी ज़रूरी है अभी।
आप चिंता मत करो, जब सर्जरी हो जाएगी ना उसके बाद आप मेरे को मिलो।
आजकल जो यूथ है उनमें हार्ट अटैक्स इतने ज़्यादा हो रहे हैं और सेलिब्रिटीज़ भी जो है उनकी डेथ सुनने को मिल रही है। आप हमें कुछ ऐसी टिप्स एडवाइस दे सकते हैं जो कि हमारे आज के यूथ को और ओल्ड जनरेशन के लिए बहुत ही बेनिफिशियल हो।
स्मोकिंग बिल्कुल नहीं करनी, हमने सेडेंटरी लाइफस्टाइल नहीं रखना, हमने एक्टिव लाइफस्टाइल रखना।
अभी समाचार प्राप्त हुआ है कि प्रसिद्ध गायक के हमारे बीच में नहीं रहे हैं, उनकी मृत्यु हार्ट अटैक से हुई है। आपको बता दें कि इससे पहले बहुत सारे सेलिब्रिटीज हार्ट अटैक की वजह से कम उम्र में इस दुनिया को अलविदा कह चुके हैं।
ये एक ऐसा सब्जेक्ट है जिसके बारे में कोई सोच नहीं रहा, लेकिन हम डेली ये देख रहे हैं कि यंग लोग जो हैं हमारे पास आते हैं हार्ट डिजीज़ लेके। बहुत सारे लोग अपनी ज़िंदगी से भी हाथ धो बैठते हैं। ये चीज़ अवॉइडेबल है। So this is just a trailer. So you can see the entire movie on YouTube. We have a channel on YouTube by my name, Dr. Deepak Puri. And it is a short 20 minutes movie. I wish that everybody should see the movie and we should share it to as many people as possible. Because I will tell in my talk about the most common causes of death nowadays. And 80% of these are preventable, just by a little awareness. So I move on to my next slide, that is on the challenges that we face nowadays in the management of healthcare, especially related to the cardiovascular. So the most people, they are now aware that Indians are affected by cardiovascular disease and other lifestyle disease like cancers at a much younger age compared to the Western population. And most of us, we are not doing anything to prevent this because the focus is only on interventions. And everybody thinks that only we have to go to the doctor when we need an intervention or when there is an emergency. And at the same time, there are various myths that promote delaying the treatment, which are floating around, and people think that there is no need to go to a doctor or to a medical professional to seek advice on prevention. Another thing that is important is that non-evidence-based promotion of unconventional methods is rampant. There's no law to prevent their advertisement about non-conventional methods which are not proven medically or by any trials. So that is also delaying the treatment and also causing a lot of deaths, because many times people, when they need a bypass surgery or they need a percutaneous intervention, they don't come to the doctor immediately and they wait. And sometimes they even die while waiting, or they seek unconventional methods which have no proven benefit. Another thing that is important is that various advances have come, like robotics and minimal invasive surgeries, and we have endovascular interventions. But we have to see what are the benefits and what are the risks. So every new thing that comes into our existence does not mean that this is the best treatment. So we have to rationalize the treatment according to the need of the patient. And we don't have to promote it in an irrational way. So at the same time, we have to face a deterioration in the doctor-patient relationship, because the trust with the doctors is going down. Although, even if we see that in the Western countries, Indian doctors, they are the best. And Indian doctors are very hardworking, they are very approachable. Still, what we find is that day by day, the trust of the patient is declining. So we have to go to the root cause, why this trust is declining and what we should do to rebuild the faith. Another thing that is important is there is too much emphasis on cost cutting. So I want to emphasize that cost cutting should not mean quality cutting. Because once you try to bring down the cost, because when we do procedures like heart surgeries, so a lot of medicines are required, lot of equipment is required, and lot of skilled professionals are required. So whenever there is an emphasis on cutting the cost, the first thing that cuts is the skilled professionals. Because you cannot cut the medicine, you cannot cut the equipment. Only thing you can cut is the number of professionals and number of skilled professionals that are required to deliver the care. So next thing I would like to emphasize is that there is lack of infrastructure in many places. And also the quality of training of the skilled professionals is not adequate. Like in India, we have like limitations in imparting skills. Because if you go to Western countries, the emphasis is on skills. But in India, like there are no programs which emphasize the imparting of skills to the person who is going to deliver the care. So most of the teaching is theoretical only. And when it comes to practical, then there are a lot of limitations. And also, there is a growing amount of stress on healthcare professionals, which is affecting their delivery of healthcare to the patients. So everyone knows that every year there are 58 million deaths, and out of these 58 million, 19 million deaths occur because of heart diseases. So almost 1/3 of the deaths, they occur because of cardiovascular diseases. And recently, after the onset of COVID pandemic, we have seen that there is a very steep rise in the fatal heart attacks. There has been a 14% rise in heart attacks 1 year after the onset of COVID pandemic, and which has increased to 29% rise. And we have seen that the rise is seen more often in the younger population between the 25 to 44 year age group. And also, we have seen that those patients who required hospitalization in the ICU for COVID, they have a much higher complication rate, like the incidence of thromboembolic complications, the incidence of heart failure, the incidence of stroke, arrhythmias and death has increased manifold. So the most common cause of death in cardiovascular diseases is heart attack. So when a person gets heart attack, time is very crucial. The person has to immediately seek medical help, but unfortunately most of the people, they don't realize this, and there's very little awareness about this, and they resort to unconventional treatment methods, or they delay their treatment because they don't realize the urgency of the situation, and every minute the muscles of the heart, they are dying. And so by the time they reach the hospital, already the muscle of the heart is dead to an extent that it cannot be revived. So the best treatment would be that we should open up the artery which is blocked within 1 hour, which is known as the golden hour. The first hour after the onset of the heart attack, this is most crucial. But in India, most of the people, they waste a lot of time. And then we also face another problem is that people who are living far off, who are away from cardiac facilities, like they have to travel for several hours to reach the cardiac facility. So without thrombolysis, you should not shift the patient, because the patient usually dies on the way. So if you are not able to reach a cardiac facility within 1 hour, then best would be that you should thrombolyze the patient, stabilize the patient, and then send, rather than sending the patient straight away. So a lot of deaths can be prevented if we know this. And sometimes the patient, they die on the way and they reach the hospital dead. So another big problem is heart failure. So heart failure, unfortunately, we have the highest burden of heart failure patients in India and in Asian countries compared to the Western population. But most of the Indian heart failure patients, they are because of delay in the treatment of heart attacks. Because the artery remains blocked for a long time, the patient doesn't reach the hospital in time, and they are not aware that it should be opened up immediately within few hours. So part of the muscle gets damaged and dies, and so this muscle cannot be revived. So although the improvement in the management of heart attacks has we have been able to save most lives, but many of them, they become heart failure patients. And almost 2/3 of the patients after a heart attack who seek delayed treatment, they are having heart failure for the rest of their lives. So if there is a 10% reduction of pumping function of the heart, there is almost a 50% increase in the chances of dying in the next few years. And also, the heart failure burden in India has special features which are different from the Western population. Most important is that we are affected at least 20 years earlier than the Western population. In the global figures, they show mean age of heart failure patient 73 years. India, it is 53 years. And also, the in-hospital mortality is 10 times higher compared to the global figures. And also, the post-discharge mortality within next 6 months, it is 3 times higher. The most important reason for this is that patients, they don't reach the hospital in time. So we started this cardiomergen in 2011. And at that time, I thought that most of the people, they are only coming to us at the time of interventions. However, for treatment of this patient, the patient has to be educated that not only the intervention, it is the prevention which is also very important. So in next few slides, I'll tell you how we can improve the management of these patients just by simple steps. So as the patient comes for the intervention, the most important question is that people, they are confused whether we should go for a medical management, whether we should go for percutaneous intervention like stenting, or we should go for a bypass surgery. So we have enough medical evidence in favor of all the three modalities, and in next slides I will tell you how we can make a rational team approach so that the best treatment is given to the patient. So in the last couple of decades, there has been a lot of improvement in the medical management of the patients. A lot of heart failure medicines have come up, and there is a guideline directed medical therapy which is recommended for the management of patients with cardiovascular problems. So once we do the medical management, sometimes it may not be enough and we require a percutaneous intervention to save the dying muscle. So it has been seen that despite the use of percutaneous interventions and optimized medical therapy, still the mortality is very high. Even the 1 year mortality is very high. So various studies have shown that there is an increased risk of mortality and heart failure hospitalization in patients with reduced ejection fraction, that is the reduced pumping, post revascularization. And it has been seen that even if you do a percutaneous intervention or you do a bypass surgery, the 30-day mortality is a little on the higher side compared to a normal risk patient. And even the 5-year mortality is on the higher side. But we have seen that there is a marginally better risk, like outcome compared to percutaneous intervention if we go for a CABG. So now the recommendation is that if the patient is having heart failure, and if the patient is having diabetes, and if the patient is having multivessel disease, then we should go for bypass surgery rather than percutaneous intervention if we have to give survival benefit to the patient. And even the short-term benefit is also better, the mortality risk is also lesser, and the long-term survival also is better. And also we have seen that if we compare the patients who have normal ventricular function, and if they have a mildly reduced ventricular function, and if they have a severely reduced ventricular function, their risk of having death or recurrent myocardial infarction or stroke, it increases over a period of time in the next 3 to 5 years. So the best thing would be that we should treat the patient well in time before the patient has irreversible damage to the heart muscle. So most of the guidelines nowadays, they say that bypass is the first choice for revascularization strategy in patients with multivessel disease, and there is an acceptable risk that we should go for a bypass surgery. And in the past, it has been seen that if we do this bypass surgery on a beating heart, then the outcome is much better. And even the American Association of Cardiology accepts this, that if we do a bypass surgery in acute myocardial infarction or in heart failure, then if we do it on a beating heart, the outcome would be better and the risk would be less. But in the Western countries, they are not able to do the surgeries in a normal patient on a beating heart, and they do it conventionally on the pump. Like they stop the heart, they put the patient on a cardiopulmonary bypass machine, and then they do the bypass surgery. But in Asian countries, especially in India, India is considered #1 in beating heart surgery. So we face this problem a lot of times. When the patient comes to us, the muscle is already damaged. Like here you can see this patient, he has had a myocardial infarction. This is the left ventricular muscle, almost damaged, and it is like impending rupture. Like if you don't handle it properly, it will rupture on table. And this is the normal muscle down below. This is the right ventricle. This is the left ventricle. And here you can see that we do a beating heart surgery on this patient. And after the surgery, the pre-operatively, the pumping was only 15%. And later on, the muscle keeps on improving. After 3 months, it may improve to say 30% or 35%, and after 1 year, many times the patients they have a normal pumping. So it takes a long time for the muscle to recover. And in the post-operative period, we need the help of other specialties, like we need nephrologist, we need a pulmonologist, we need endocrinologist. Many patients, they have complications related to other specialties. So it has to be a teamwork. It can't be that a single surgeon can do everything. We need the help of the cardiac anesthetist during the surgery. And in the post-operative period, we need the help of intensivist. But if we give a proper surgery, we also need the help of physiotherapists, dietitians, to enable the patient to have a good rehabilitation and then go back to normal work. So now this patient will also require guideline-directed medical therapy in the post-operative period. So till the patient recovers fully, he has to be managed by a cardiac team in which there will be a cardiac surgeon, a cardiologist, there will be intensivist, and there will be specialists from other branches like nephrology, pulmonology, endocrinology. Everybody will jointly manage this patient to give him the best benefit. So there are other now technologies which are available, which have helped in improving the post-operative outcome of the patient and the recovery of the patient and patient satisfaction. Like we have this endoscopic vein harvesting techniques in which without making big incisions, we can take out the veins through small holes. And also, like I went to US to get trained in robotic surgery in 2009. And we were thinking that maybe we can start robotic cardiac surgery in India at that time. I went to University of Maryland, and the president of robotic surgery, Dr. Jonas Bonatti, was there, and I wanted to get trained under him. And every day we were doing 2 bypass surgeries by this robotic technique. And some of the surgery, they were done by hybrid technique, like few vessels they were bypassed by the robotic technique, and other vessels they were stented by the cardiologist. But later on, like we found that even after this, using this extremely costly robotic technique, the patients were discharged from the hospital after 3 days. And a lot of equipment is required. The robot is quite costly, and the cost of the surgeries is extremely high. But here in India, we were doing beating heart surgery, and after doing a good beating heart surgery, we keep the patient for 2 days in the ICU, and on the 3rd day, we discharge the patient home. And the cost is almost 30 times less, and the outcome is better. Like even in Maryland, later on they realized that the long-term outcome of this robotic surgery was not as good, so they also abandoned this for cardiac. And India also, one of the hospitals in Delhi, they started robotic cardiac surgery, but later on they had to abandon because long-term outcome was not good, because we can't achieve that precision of doing the coronary bypass, which is just 1.5 millimeter artery, and you have to put several 10 to 15 stitches on that artery, and that precision cannot be achieved with this Da Vinci robot. So another thing that is important is the onset of endovascular surgery. So when we went to Orlando for the conference, that time one of my Japanese friend, he was very expert in doing this aortic aneurysm surgery. So he was supposed to deliver a talk, and he said that when I was young, I used to do long operations. I used to do operation for 12 hours, 16 hours, 24 hours, and after the operation, after a few days, patient used to die, or maybe he used to die after a few months. So after some time, I thought that why I am doing these operations. So why can't we do something better? So that thought stuck into my mind, and now I realize that today we are no longer doing all those long surgeries. We do the procedure by endovascular technique. We just insert a guide wire and we insert the stent inside. It takes just half an hour and the patient goes home on the next day. So there has been a tremendous improvement in the last 2 decades. And then we have patients who are elderly patients and having heart failure, several comorbidities. They come to us with aortic stenosis, and if we do the surgery by the conventional method, then the mortality rate is a little higher. So recently, like in last decade, this technique of doing this percutaneous valve replacement has come up, which is known as TAVI or TAVR. So nowadays, for such patients, we are simply doing this procedure and the patient goes home in a couple of days and without the increased risk of doing the conventional surgery. So ultimately, the other group of patients who have heart failure, and we cannot do anything for this patient except a heart transplant. So these patients, they are increasing in number day by day, and as you grow older, the chances of having heart failure increases with age. So the unfortunate thing is that although the number of transplant in India is increasing, we have paucity of donors. Even in US, if there are 75,000 patients who require a heart transplant, only 2,500 they receive a donor heart. And the situation is much, much worse in India. So here you can see that most of the heart transplant, they are done in either North America or in European countries, whereas the burden of heart failure patient is maximum in Asian countries and maximum in India. So what we can do about it is that other options that are available are the ventricular assist devices and the artificial heart, and these are being used as either a bridge to transplant or they can be used as a destination therapy also, like if we can't give a donor heart to the patient. But the problem is that these technologies, they are good, but they have their own complication rates and they are very costly. They are not affordable by everybody. So for Indian population, we have another option that is much more affordable, and this is the cardiac synchronization therapy, and this is useful for those patients who have a delayed conduction. Here we can sequentially pace the 2 ventricles, and we can even put a defibrillator by which we can prevent sudden death and we can improve the pumping of the heart. So this has been very useful, and many patients, they get benefited by this therapy. So another thing that is very important, but it's still not available for a normal patient, that is the regeneration therapy or stem cells. So stem cell may probably help in regeneration of the heart muscles, but there have been various trials in which we have tried to see whether the patient can be benefited by a percutaneous intervention or by injecting it directly into the heart muscle. But the problem is that the cells, they don't stay there and they die quickly because there is no blood supply to that dead area. So how to create that blood supply and how to make the cells survive and how to make them multiply into normal cardiac muscles and how to make them function also in a normal way. That is the main challenge. And a lot of trials are going on, but still it is not available for giving to the patient. So now we come to the original thought process that was going on in my mind, and when we started the cardiomersion. So what we want to promote is that instead of waiting for all these complicated procedures, we can start from primordial prevention. When early in the childhood, when there are no risk factors, we can start the prevention from there on, and later on, once the person acquires some risk factors, then we can do the primordial prevention to take control of the risk factor. And then if the patient has some symptoms or there is the onset of the disease, then we should diagnose early and we should give the best possible treatment. And if that stage is also crossed, then we have to give the intervention to the patient. And after intervention, we have to give proper rehabilitation to the patient and we have to do the secondary prevention. And if we follow all this, this will improve the outcome of the management of the patient, and also the long-term survival of the patient also improves, and at the same time the cost of the treatment also becomes very low. So if we have to give best treatment to the patient, we have to work at all levels during this journey of life, and we have to give the appropriate treatment at the appropriate time. So in the end, I will request that everybody should relax and also take care of your own health. We should become physically active, we should remain happy, and we should prevent heart disease, not only in the society, in the medical fraternity also. Because many evidences have revealed that doctors, they live 10 years lesser than the non-medical population. So it is time that we should join hands and we should take care of our health and the health of the society. Thank you.
Thank you so much, sir. Now I request to Mohammad Azruddin Farooqi and Dr. Fareen Khan, please come up on a stage to present Memento. And I request also Speaker Dr. Deepak Puri, sir, please come up on a stage. Thank you so much, sir. Thank you so much. So once again, I request to Dr. Deepak Puri, sir, please come up on a stage to present few mementos. The iconic Healthcare Leadership Award, Obstetrician and the Gynecologist Award goes to Professor Ashla Batra. National President, National Associate and the Reproductive and Child Health. Congratulations, ma'am. Ma'am, it's my humble request to you, please say a few words.
Good afternoon. At the outset, I'd like to thank Golden Aim Awards for recognizing the work done by me. And it is always my endeavor that the society has given us so much as doctors. They have invested in us by making us doctors and postgraduates. So I feel now, after having done the work for my satisfaction, it's time to give back. And all of us should do that. Whatever we've got, we must give back. And that is the reason that I like to work for the society. Thank you.
Thank you so much, ma'am. The next award, Innovative Healthcare Leadership Award, ENT Surgeon, present to Dr. Ankur Gupta, Consultant and Owner, Healing Care ENT Clinic, Noida. Congratulations, sir. Sir, would you like to say a few words?
Good afternoon, everybody. I am Dr. Ankur Gupta. I am an ENT surgeon. And thank you, Golden Name Award, Dynergic Business Solution, and jury members for selecting me for this prestigious award. This is not only an award for me, it's a motivation and an energy for coming years. Thank you. Thank you so much.
Thank you so much, sir. The next is Iconic Healthcare Leadership Award, presenting Dr. Ajay Bhalla, Director and HOD, Fortis Hospital, Noida. Give a big round of applause, Dr. Ajay Bhalla. Congratulations, sir. Thank you so much. Thank you so much, sir. Thank you, Deepak, sir. Sir, it's my humble request, please. Yeah, but your worth is more important.
Yeah, I would just say thanks to Golden Name Awards because, healthcare professionals have been rendering service for a long, long time. And it's the recognition which seems to be lacking. And today I was quite honored, and I was seeing other people also who felt the same. And I shared the same emotions. Thank you for recognizing whatever little that we are contributing. But I guess all the healthcare professionals, on behalf of all of them, I thank Golden Name Awards. Thank you.
Thank you so much, sir. Now I would like to call upon the stage our next speaker, Mr. Chetan Khurana, CEO Founder, Scale Reform. Ladies and gentlemen, please give a big round of applause, Mr. Chetan Khurana.
Can I have a presentation, please? Good afternoon, everyone. It was great listening to the eminent speakers here, especially Dr. Deepak Puri. I see a different, other than a doctor, a side hustle in you to be a potential director after looking at your movie. Let me have the presentation. Let me just introduce myself and my organization. I am the CEO of Skills Reform. We are into career guidance. We are into skill development. We work with potentially 60 plus different schools and colleges and different institutions pan-India to help students look for a right kind of opportunities for their career. Go back. So why I have chosen this as a journey for life, it is only because sometime or the other, we all were confused when we were in our high schools that what do we want to do in our life? How do we want to start it? We did not have, most of us at this age, when we were in high schools, we did not have the right career guidance, career counselors with us. So who motivated you to be a doctor? Because in this room, I can see most of you are doctors. Some of the principals are also here. But what motivated you? Is it inner self, or is it something to do, your parents are already there? That's how you chose to be in the same field? What was that? I do not want it to be a monologue. I want it to be a dialogue, only because whenever we work with students and teachers and principals. Yes, ma'am.
Hi, Dr. Chetan. I'm Dr. Abha.
I know
And-
ma'am very well because my sister has gone in your clinic, I think 10 years back. So I know you well.
Okay, thank you. So I did my MBBS in 1974. I entered the medical college in 1970.
Mhm.
That was the changing times, maybe for the whole world, but for India definitely.
Correct.
Girls had only 2 careers. When we did 12th, either we would become a teacher or a doctor.
Mhm.
And nursing, of course, was there, but if you were a slightly better student, then these were the only 2 options.
But were your
And-
parents there in
No,
the same field?
my parents had nothing to do with my career. Well,
Okay.
I lost my father when I was a young girl of 11-year-old.
Mhm.
So there was no guidance. None of my parents, none of my family members
Mhm.
were in this profession at all,
Mhm.
far and distant also.
Mhm.
So it was only this that being brought up in a level 3 city of India, where there were very few educational options, there were no career options. The only thing which I could foresee was either I became a teacher or a doctor. And as luck would have it, I appeared for a PMT and had a very high ranking in that and was selected. That's how I did my medicine. Nowadays, the options have changed. There are like 50 options for girls. And if parents are doctors, then most of the children go into this profession.
Ma'am, only medicines, there are 100 plus options available.
Yes.
And to your guess, how many options are available as careers
For
overall?
girls,
Overall
Oh,
careers.
I don't know. You would tell us today.
It is
We hear from-
12,000 careers options which are available.
Wow.
So
So this is
from
50
two-
years down the line.
Yeah.
1970.
Yeah.
And now we've moved to the 1920s.
Yes. Thank you so much, ma'am. Thank you so much
2020s, sorry.
So why we call it as Journey for Life? Only because life is all about journey. Life is not about the race that we are into. For example, if we are looking at what we tell students, whenever they would like to see the career destination that they would like to see, compare that with the holiday destination. How do you want to reach out to your destination, a holiday destination? What are the things that you take care of? So this is the old model that we were all working, and this was initiated by Yale University, that this is how a career guidance cell supposed to work. They will do career assessment for you, they will identify and give you research options, evaluate and prioritize those options, take actions and try options, and reflect and re-evaluate. But do you think that it is working? I'm sure that most of your wards are in school and are looking at some kind of, would be in some kind of dilemma in terms of what career to choose from. If it is not medicines, if I cannot get into blood and I do not have dexterity to go for surgery or medicines, what should I do next? So have you gone through such kind of assessments with your wards yet or not? You have gone through that? So how was your experience? What is your child doing, or whosoever has gone through that?
Thank you, and I think I'm so glad that you're out here and giving us these options. I am a young mum. I would consider myself young. I have a son who is pursuing his law at LSE in London, and there was a phase where he was confused because he loves theatre, he loves to debate, and he loves to perform. And he had his utopian ideas that maybe Bollywood, Hollywood. Then came the idea that I want to only debate, dabbled between politics, and then we came to law, as you said. So first, I would always tell him, what is your core passion? Because any field in life, as you said, 12,000 options, you've got to choose one which resonates with your heart.
Yeah.
So we looked through everything, then we evaluated and prioritized, and then I said, see yourself, short-term goals and long-term goals. So, in England, when we would always be taken up for an interview, it would always be 2 years from now, 5 years from now, 10 years from now, 15 years from now. They're too young. They're teens full of hormones.
Yeah.
They're not able to see 10 and 15 years. But what you can see is, as you said, to prioritize what really resonates and then to take action and see yourself in each of these roles and see that through the years ahead. So when he did, he found out that the best melody for him with all of these was law. So you can be in the courtroom, you can do your drama, you can be as charismatic as the guys in suits, and at the same time, whatever said and done, these young kids do want to make their money. And they want to make sure
Everyone
that
wants
their
to.
hard work is reflected,
Correct.
in the outcome. I
Yeah.
think when we grew up, as Abha ma'am said, it was follow your passion and you worked hard. Our end goal was never that how much you're going to get out of it. Still, I think it's a hall full of doctors and everybody saying our passion is to give the education, to move it ahead. But these young kids, I think what you have to help them is see their dream and give it a realistic twist as well. And sometimes as parents, we have to also look back and see that it's not to categorize into only professions that we know of and
Yeah.
that we've learned of.
Yeah.
The world has really moved ahead. There's opportunity in anything and everything. It's just how you hone that skill, but you must love what you do. Because you
Correct.
could even be an artist. And if you don't love painting, it's not going to show through.
Yeah.
So
Thank you
yes,
so
it's
much.
a lovely step approach that you've done.
No,
Thank
so
you.
this was the current process. But to your dissatisfaction, only 15% of the employees are engaged in the workplace.
That's true. If they're not going to follow what they love to do, they will,
So if-
quit. So
Yeah.
when you go and you look, even kids today abroad, when they're doing their processes,
Yeah.
what you also look at is once you've finished, what is the next step? How many are pursuing? Even us as doctors, most of us are completing our profession as doctors. There's enough who've now forayed as doctors into any line. They're entrepreneurs. You have doctors in the management field. You have doctors everywhere. So I think even when we counsel young kids, because lots of people have myths about medicine as well, lot of hard work, and you don't get your satisfaction. That's not true. We are here to even dispel those myths. As a doctor, you're as empowered to do anything you want to do. It's just about seeing the horizon.
Correct. That's perfectly, true to the what you are saying. But still, if you will see that only 15% of maybe doctors would be in those 15%.
Absolutely.
But 85%.
But we're
that's
starting to a point where
it
we were
is-
nowhere there.
It is not only you, but the world is starting.
Yes,
World is
yes.
starting to look at something new and bigger opportunity, not for us, but for the wards, those who are the young adults, those who would like to get into the future world of work. These are the barriers and biases which are still available, curtailing to the previous slide that why there is so much of dissatisfaction. There is a family pressure, there is family friends pressure, there is peers pressure. Now in the world of digital, everything they are focusing, young kids, they are focusing on, and they are totally dependent upon social media. That okay, being an Instagrammer, I do not have that quality to be an Instagrammer, but still I want to earn money, which is being seeded in their mind at so early age as 6th grader, those who would lying and trying with the help of their parents to be an Instagrammer, which is which is going beyond the horizons that we are looking at in terms of a career counselor, that there are more barriers and biases like gender, race, religion, socioeconomic status, and sexual orientation, which is coming up now in India also. So how we have done, how we have emerged as skills reform after going through, so I will tell you my journey. I also wanted to be a doctor, but in 11th or 12th, I got to speak to someone. I took medicines as the subject, but I got to speak to someone, my parental's friend, those who are in US, and he said that, okay, go through an assessment and look for what kind of things that you actually want to do. So I have gone through that assessment myself in year 2000 when I did my class 12th, and it was totally management, business, and entrepreneurship that time. It came as a top choices for me. Then I started excelling. I did my management from Punjab University and MBA from IIM Lucknow, just to get hold of what exactly I want to do in life. What I want to pursue, what is my passion like, who I am, and what I like to do. These are the two questions that I have asked myself, and today I am standing in front of you I may be the youngest in the crowd, but I have gathered experience of about 16 years in various work fields, starting from consulting in manpower, into strategy with Hero Group. All that thing combined together, I have taken this initiative of starting something on my own. And I was hiring people at CXO level when I was working with ABC Consultant. I thought that there is some problem, why I am not able to find the right people for the right job. So I went back, looked at that, and then I joined Hero Groups, university and schools, started working with students at that level. I thought this is also not a right age that people would be looking at. Let me go beyond it and let me reach out to the early ages. So we started with this concept of skills reform, where we are reaching out to students as early as 6th grader and telling them about what exactly would they like to do. Like ma'am emphasized on passion, passion is one thing that people are not aware of. They are not self-aware. So we held them out with a different concept, which is called as design thinking. So 97% of the students are now looking at technology to help them out, carving their career choices, career decisions. So we implanted this human technology, human intervention, and human intelligence with technology called design thinking, which was mostly used by the companies, Fortune 500 companies. Design thinking is a simple approach that I reach out to my customer, look at through the questionnaire what exactly do they like to do, what they want to do as a solution. Then empathize with them and then ideate, giving them the options to choose from. And then look at creating the prototype of what exactly their idea is and how we can create a prototype which we can take it to market. Likewise, we have changed it to career awareness and career decisions for students. And trust me on this, I will take one example of an MBBS student. He was a third-year student who got hold of us, and he said that, I am not very good at doing what I am doing. I said, why? You are in third year. He says that whenever I see blood, I feel nauseatic. We told him, just take time. It will, 1 more year, 2 more years, give it to it, and then you will get to know about what exactly, are you dexterous or not. He came back to us after a year and he said that, no, I never wanted to do it. So we asked him, what exactly you wanted to do? He said, I wanted to be a design engineer, but my parents said that, okay, we are in medicines, get into medicines. After spending 1.5 years with that guy, we finally found a good design approach for him, which is called as prosthetics. Now he is working with one of the top companies in Germany into prosthetics and designing. He's a doctor, MBBS doctor, but now he's working with the company in prosthetics. So I urge each one of you that, okay, if you have your children have not found the ways and means of looking at the right career decisions, it is the right age, whether they are in 6th standard or 7th standard or 8th standard, start early. Get them into different fields. Let them experiences rather than they getting into MBBS or engineering or law, which are 3 top choices of every Indian family, to explore more. There are 12,000 careers which are available. Please give them a chance to introspect what they like, what is their passion. It is not about, what I want to be. Rather than that, it should be who I am and what I want to do. Starting with that, So one more approach that I wanted to discuss with you, to get into design thinking, the problem that we have with our system, especially in India, that we work mostly on the solution without understanding the problem. If a child with your help will get to understand the problem and emphasize 55 minutes of their 1 hour into understanding and analyzing the problem, they will get 10 different solutions, which would be in 5 minutes, which would be more apt for their career decisions. Thank you so much for today. And I am Chetan Khurana. You can reach out to us for any help that your ward has regarding career decisions that we would like to make. Thank you so much.
And I request to Dr. Fareen Khan and Mohammad Azruddin Farki sir, please come up on a stage to give a thank you memento, Mr. Chetan Khurana, co-founder of Skill Reform. Thank you so much, sir. Your valuable share with us, your valuable knowledge with us. And sorry for the technical issue. Thank you so much, ma'am. Thank you so much, sir. Chetan, sir. It's time to next category awards. It's Education Award Ceremony. I request to once again Mr. Chetan Khurana, co-founder of Skill Reform, sir. Please come up on a stage to present award ceremony. The next category of for excellence and the leadership in education, the first category, Most Iconic Vice Chancellor Award, goes to Professor P.N. Shastri, former Vice Chancellor, Central Sanskriti University, Delhi. I request to each one of you, please give a big round of applause. Professor P.N. Shastri, sir, please come up on our stage. Professor P.N. Sastry and Dr. Chankeshwar Kumar, the Vice Chancellor, not available here because they are sharing stage with the PM. Okay. The next category, Most Prestigious Education Professional in Asia, Dr. Mariam Sheikh from Dubai. Not here. Okay. The next category, Iconic Woman Education Personality of the Year, Dr. Ruchi Seth, Director Principal, Lotus Valley International School of Noida. Congratulations, ma'am. And I request to you, ma'am, please say few words.
नमस्कार, मेरा नाम डॉक्टर दीप्ति सिंह है. मैं डॉक्टर रुचि सेठ के बिहाफ से ये अवार्ड ले रही हूँ आज. We have a school at Noida with the strength of 4,500 students. So Chetan, when we are talking about skill development, that's what we do in schools. And we do a lot of awareness related to community service in the field of medicine. So I have a great gratitude towards the organizer for giving us this award today. Thank you so much.
The next category is Top 10 Highly Effective Principals in North India. Ms. Archana Soni, Principal of Chinmaya Vidyalaya, New Delhi. I request you, please come up on our stage. Okay, on the behalf. Your name, sir? Congratulations, sir, and I request to you, on the behalf of ma'am, please say a few words.
Good afternoon, everyone. Thank you so much, the Golden Aims Award, for recognizing the school, for the principal for giving this wonderful award. Thank you once again.
Thank you, sir. Next is Alka Kapoor, Principal of Modern Public School. Next, Ms. Shalini Manhotra, Principal of Vidya Devi Jindal School, Hisar, Haryana. The next, Professor Dr. S.P. Agrawal, Professor Principal, Ramanujan College, Delhi University, Kalkaji, New Delhi. Dr. Rajpal Singh, Principal, GMN College, Ambala, Kent. The next, Dr. Indu Khetarpal, National Award winner, former Principal, Salwan Public School, Rajendra Nagar, New Delhi, presently working as a consultant with National Testing Agency, GOI. The next category is Quality Education Leadership Award, Raghvendra Monpal, Managing Director, Manworld Education. Congratulations, sir. Kamal Singh is here on the behalf of the Raghvendra Monpal, sir. Congratulations, sir. And I request to you, sir, if you like to say a few words on the behalf of the sir.
Thank you, everyone. Thank you so much for this award. Thank you so much.
Thank you so much. Thank you so much, Chetan Khurana, sir, for joining us. It's time for lunch. Let's have a break for lunch. And after lunch, we do continue with our first speaker, Dr. Vandita Arora, presenting Indian Society of Electrocardiology. Topic, Artificial Intelligence in Cardiology. I request to you, ma'am, please come upon a stage.
Good afternoon, everybody. Okay. Thank you. At the onset, I would like to thank the organizers of Global AIM Award for having me here. I know it's a post-lunch session, so everybody must be feeling really hyperglycemic and sleepy. And with the amount of audience around, we can see that how many people had to rush for a Sunday nap in the afternoon after such a good lunch. So my topic for today, which I chose, was artificial intelligence. Artificial intelligence is the new, what should I say, it's a new toy in the market, but it's really not the toy, it's actually very intelligent toy. And it is making our lives very easy while we are treating the patients. During the COVID time, we have learned a lot of things, some good, some bad. But most of the time, we have learned that the contact with the patient, sometimes you have to avoid that contact and still make the right diagnosis, still give the best treatment to the patient. Henceforth, artificial intelligence comes in very handy. So a couple of slides to see where we are today and what more we can do for this. The ubiquitous ECG, what can be seen? Where is this recorded from? We should know that, and to have answers to that, we need artificial intelligence, and this is how I will go through with my presentation. So, set of technologies that allow for intentionality, that is the sense in the environment to see how the reaction goes, the intelligence which considers various inputs and arrives at a decision, and adaptability, the ability to change in the future based on our experience. This is the history of AI. It is not a new thing. Though in medical profession it is a new thing, cardiology it is a new thing, but it started from 1940. And we have been using artificial intelligence in various modes of life. And now we are using in cardiology to interpret ECG. and find out answers from there. ECG is the simplest investigation, and it is the worldwide investigation that is available to us, and it is the first investigation in a cardiac patient. And if we have an ECG here, you know, we have to see the sample signal, we have to make it go through a convolutional layers, and then get them fully connected and have an interpretation of a model ECG for a certain incidence, for a certain condition. And what we are scared in cardiac patient is ejection fraction, that is the heart function. How the heart behaves in a cardiac patient is very important. We normally need an echocardiography to have an answer on the ejection fraction. Now, echocardiography is also very commonly available, but it requires the contact. You have to have your contact, your hand on the chest of the patient, and you have to sit in close proximity of the patient to calculate ejection fraction. But what if you get the answer from a simple ECG, and you can know whether the heart function is less than 35% or normal? So this is the importance, and the correlation has been very, very good. We have a lot of data which shows us that LV systolic dysfunction actually can be interpreted faster with ECG than with any blood test or than with the echocardiography that we use to have that interpretation from there. And there have been a lot of published data from this, and we have been concentrating on correlating ECG with the LV ejection fraction. Now, atrial fibrillation is another arrhythmia which we are very scared of. Why we are scared of? Because it causes stroke. It not only works on the mortality but morbidity of the patient, because it causes stroke, and that can really make a patient bedridden. So we are scared of this arrhythmia. But what if we come to know that, okay, within next 15 days patient is going to have atrial fibrillation. But just by seeing today's ECG, we can predict 15 days later arrhythmia that will come in the patient. We can start the patient on proper treatment. We can start anticoagulation to prevent that episode of stroke. So that is where we are moving on with the algorithm of ECG on artificial intelligence to predict the occurrence of atrial fibrillation, and this correlation has actually been very, very good. The vascular age of a person can be predicted with an ECG through artificial intelligence. Whether you are a male or a female, the ECG can predict it, and what is actually your vascular age, that can be predicted with the artificial intelligence, and it can subgroup you in the age group that it has been predicted for the ECG. Now, what are the causes of optimism that we have? Well, we have access to the computing power, the data storage costs are being worked out, and digitization of data is becoming a reality now. And in case we are able to solve for India, which means that we will be able to solve this problem for 40% of world's population, which is a huge number and is of huge importance. The technology sharing and local modifications for the local economies is going to be very, very good. In India, the current artificial intelligence adoption has been in various fields, least in travel and tourism, while in financial services it has been very, very common. But it is the healthcare which needs the maximum importance in India for artificial intelligence. So when we talk of healthcare and cardiology, we have 0.76 doctors and 2.06 nurses and 1.3 hospital beds per 1,000 population. This is the present data. What is the requirement? The target that we need is 1 doctor, 2.5 nurses and 3.5 hospital beds per 1,000 population. And it has to be an individual-driven healthcare, because on institution-driven healthcare has not worked very good in our country. The affordability in our country, affordability comes from patient's pocket, and it is actually oops. 70% of healthcare in India is oops. What is oops? It's not painful oops, it's more than painful oops. It is out of patient pocket. It's not reimbursement. It is coming right out of patient pocket. And we have analyzed that 47% of rural and 31% of urban population which come for treatment, they are financed by either loans or they are financed by selling of their assets. So this all has to be worked out positively in case we have to do right by our country. And about 63 million are faced with poverty due to the healthcare expenses. Such heavy is the load of healthcare expensive. So reactive approach to healthcare is required, and democratization of healthcare is the need for the day. And artificial intelligence, of course, can work to take care of a lot of these expenses, because with one simple ECG, we are able to give you a lot of answers. There have been a lot of publication and work going on, some from India too, which is there, especially in Bangalore, it is going on. One of my friend has loaned me a couple of slides. His name is Deepak Padmanabhan. He's working at Jayadeva Hospital, and I thank him for his contribution to this talk. The stakeholders in India are all these, and the most important is academia during the core research. That is the first and foremost thing that we require, and it is the utmost thing where the expenses should go in, so that we are able to go forward in artificial intelligence. A lot of publications have been done, phase 1, phase 2, phase 3 trials to see the oversight of artificial intelligence, and FDA has cleared the ECOS heart disease detection by artificial intelligence for adults and pediatrics through this device. I wish we could have the artificial intelligence at such a level that when we had something like the pandemic that we had of COVID, an ECG through artificial intelligence could have given us a lot of answers for COVID management. But it was not there still. So this is how we manage the signals. We require the raw data, and this raw data is transmitted into the database as the raw signal ECG and the surface ECG signal. So they are collaborated, and then that data is analyzed for various conditions. This is the published data by my friend Dr. Deepak Padmanabhan. This has been presented at Heart Rhythm Society 2020, where through this machine, this is a surface ECG which is taken, it's analyzed with the filtered high frequency ECG, and the interpretation for atrial fibrillation, ejection fraction is done through this. This is the future we have. By seeing a simple ECG, we will get the database, the results, and it will be telling us the chronological age, the probability of low ejection fraction, the probability of hypertrophic cardiomyopathy, which is a very important condition in cardiology, and probability of atrial fibrillation. So this is how just one single ECG will give us all these answers. This is the peek into the future. That's how the algorithm works of artificial intelligence, and we are looking at point of care with this in the future. The prospective evaluation of a smartwatch enabled detection of left ventricular dysfunction is on the way. This is being analyzed. It is published. More and more data is coming. The smartwatch has gone a long way. The Apple smartwatch has got the FDA clearance for atrial fibrillation detection. So this is the next future, and that we will be having such graphs correlating our data from a single ECG. So we do have a multi-modality integration of all these things with lesion control and lesion set modulation, and a national digital health blueprint has been made by the government already in 2019. The Apple and Singapore are rewarding the Apple Watch users for keeping healthy. This is how they are rewarding their citizens, because they use the Apple Watch, they keep themselves healthy, and the healthcare economics is actually helped if you keep yourself healthy. Because there everything is through the government. That is why government is giving awards, in case you are healthy, you are getting an award. Here everything comes from the pocket. So we ought to take care of our money by keeping ourselves happy, and this is one way of doing it. So the National Digital Health Mission, of course, should be doing partnering with citizens, doctors and healthcare providers in creating a digital health system of artificial intelligence. So artificial intelligence, ladies and gentlemen, is guided by ECG and interpretation. It is scalable. It has a predictive value. The data validity is critical. We can use case scenarios and population definitions. We still have legal and insurance implications to be worked out, and iterative learning is needed in this subject. Thank you so much for your patient hearing.
Thank you so much, ma'am.
You want me here?
Yes, I want to hear. Now I request you Dr. Fareen Khan and Mohammed Azruddin Farooqi sir, please come up on a stage and give a thank memento. Dr. Vanita Arora ma'am. Thank you so much, ma'am. Ma'am, now I request to you, please present the mementos, next categories award. The next category award is first, special awards for excellence and the leadership in the real estate. Most innovative architect award in Delhi. Nomita Sahani, partner designed by Meta. Ladies and gentlemen, please give a big round of applause for Nomita Sahani. Maybe she is not here. Okay. The next awards, most iconic architect award, Mr. Deepak Singla, architect, Habitat. Next award, Award for Excellence and the Leadership in Healthcare, outstanding contribution in the field of healthcare, obstetrician and the gynecologist, Dr. Mandakini Megha, national president. Maybe she's not here. Okay. The next category. The next category, most trusted orthopedics oncologist, Dr. Vivek Verma, head department of the orthopedics oncologist, Max Hospital, Padpadganj and Vaishali. Congratulations, sir. Kanika? Sir, it's my humble request to you, please say a few words.
Thank you very much for this honor. Yeah, thank you very much for this honor. I am Vivek Verma. I am orthopedic oncologist. So this is a relatively new specialty where I deal with all the types of bone cancer, soft tissue cancer. What people used to do for any type of bone cancer, amputation was done, which means they chop off the limb. So I was trained in Tata Cancer Hospital, Bombay, and now I head this department at Max. And basically what we do is we do limb-saving surgeries in these types of cancers. We prevent limbs getting amputated, and because this especially happens in young kids, younger patients, so there's a loss of productivity for all these patients throughout their life. So by these surgeries, they are more predictable, more productive, and they can contribute better to the society, as well as the cancer gets cured at the same time. Thank you.
Thank you so much, sir. The next category, ma'am, please. The next category, most trusted Breast Surgical Oncologist, Delhi, Dr. Nirja Gupta, Breast Surgical Oncologist, Orthoplastic Surgeon, LYF Medical Central, Prashant Vihar, Delhi. Congratulations, ma'am. The Ma'am, please say a few words.
Thank you so much, Golden Aim, for giving us this platform. It's so encouraging to see that the untiring efforts of all the physicians, coming to such a pleasant platform here. So when you talk of women health, most of us, we know that women health is a backseat. Whether it's even an educated woman like me, or it comes to a rural woman, they usually don't take care of their own health. So when it comes to breast, they are not the ones who will come forward and say, I have a breast lump, which is not looking nice. So please look at this and let me know what can be done. First of all, diagnosis. Diagnosis delayed most of the time, they're not coming. So we are trying to educate all the women, trying to educate and communicate with the normal community to come forward and take care of their own health in terms of precaution, in terms of screening. And the most important and the heart-touching thing is, what really moves me is when the patient comes to me with a lump and she knows the breast is going to be out. There is no second possibility to her, which has already been conveyed to her. And she's devastated. She knows from inside the breast is going to go. And patient is saying, I want to save my breast. The family says, no, aap isko nikal do. Kyun nikal do? So you need to understand, they have to understand where is that line drawn between a mastectomy and saving the breast. So I have got few patients who have really been courageous. They came forward. They said, "Mera breast agar nahi nikalne ke baad, I can, fight the disease, come out clean from the disease and be healthy and normal. Then I'll rather save my breast." And she did. There are a few of them. Or I'm really glad I had such patients. They're so courageous, and it's really nice to see them to fight the entire family, fight the social people around the community. घर वाले हैं, बिरादरी वाले हैं, tell them कि नहीं, I'm going to take my own decision. So this is really, really nice. And in my journey, I just try that the most important thing, the roadblocks, their education, they're not educated, they don't know how to understand what Google is telling and how to perceive it, how to deliver it. So we are the ones, we have to educate them. You have to tell them the right thing, what is right, how to perceive it, handhold, and through the entire treatment so that they come out of the disease clean and they have a normal life. Thank you so very much.
Thank you so much, ma'am. The next category, most trusted clinical nutrition in New Delhi, R.D. Geeta, Head Clinical Nutrition and Dietitian, Max Hospital, Shalimar Bagh. Congratulations, ma'am. Ma'am, I request to you, please say few words or share your experience with us.
Namaskar everyone. I am dietitian Geeta Baryok and I'm a registered dietitian. I have an experience of 24 years and for the past 12 years I'm working with Max Healthcare. I'm very passionate about my work for the community and I'm sure this award will strengthen Seva Bhav in me. We all know nutrition has a very preventive, promotive, curative and rehabilitative role. So this award goes to my all passion. Thank you so much.
Thank you, ma'am. Yes. The next award, Most Dynamic Young Healthcare Leadership Award, Head and Neck Cancer Surgeon, Dr. Snehal Bhupesh Shah, MBBS, MS ENT, MH Head, Neck and Surgery, Steffi Hospital and the Branch Kennedy Hospital. Congratulations, sir. I request to you, sir, please say a few words.
Hello. So good afternoon. I am thankful to Dynergic Solutions to call me all the way from Mumbai and give me this award. I am a consultant at Breach Candy and Saifi, but I also cater to social causes, so I run a tobacco cessation clinic. Tobacco is the root cause for oral cancers and majority of head neck cancers. So I do run a tobacco de-addiction programs. At the same time, I am also a professor in one of the medical college where I cater to only tribal patients, where I provide free for service to all my cancer patients. It's a thyroid cancer belt, so I also treat thyroid cancers there. So thank you, thanks a lot for that.
Thank you so much, sir. The next category, most preferred radiation oncologist in Delhi, Dr. Kanika Sood Sarma, Director of Radiation Oncologist, Dharamshila Narayan Super Specialist Hospital. Congratulations, ma'am. I request to you, ma'am, please share your experience with us.
Thank you. At the outset, I thank Dr. Fareen and his team for recognizing our work in this field. I think I saw a lot of oncologists here, so I think oncology is getting its platform now, because cancer is one of those diseases people don't want to talk about. Reason being because it is so gray. That is why people are not wanting to read about it. That is why people avoid those TV shows which are talking about cancer. So as oncologists, I think me and my colleagues, what we are doing now is also venturing into preventive. So our role here is not just to treat patients. We are making awareness campaigns also so that more and more people know what are the causes for cancer, how they can reform their lifestyle and avoid getting 40–50% of cancers which are preventable. So thank you for recognizing our contribution, and thank you. Over to you.
Thank you so much, ma'am, to share with us your valuable experience and information. The next category, the Most Trusted Healthcare Leadership Award, Infertility and IVF Specialist, Dr. Seema Pandey, Director, Seema Hospital and Eva Fertility Clinic and IVF Center. The next category is the Most Dynamic Young Healthcare Leader Award, Orthopedic and Joint Replacement Surgeon, Dr. Arpit Tiwari. The next category, Most Trusted Gastrointestinal Surgeon and the Robotic Surgeon in Delhi, Dr. Saurabh Bansal. The next category is the Iconic Healthcare Leadership Award, Gynecologist and the Laparoscopic Surgeon, Dr. Abhiprasha Mishra. Thank you so much, ma'am. Now I would like to call upon on stage our next speaker, Dr. Sanjeev Gulati, President, Indian Society of Nephrology. Topic, Role of Telemedicine in Nephrology. I request to all of you, please give a big round of applause for Dr. Sanjeev Gulati.
Thank you, and good afternoon, friends. At the onset, I'd like to thank the Dynergic Group for inviting me here and asking me to share my thoughts on digitalization, and I thought I'll speak upon telemedicine and how we have learned from the COVID pandemic. There are several learnings on this, how telemedicine is rapidly transforming our lives. And I'll share with you some of the work that we have also published in scientific literature. So we'll start with definition. Telemedicine literally means healing at a distance, and the American Telemedicine Association says that telemedicine is the natural evolution of healthcare in the digital world. So that's how digitalization is affecting healthcare. And as the COVID pandemic, literally took us with a storm, there were innovations, and the healthcare fraternity was adapted quickly by trying to save their patients by working from a distance, which is with telemedicine. This is some history of telemedicine in India. It was initiated in 1999 at Sanjay Gandhi PGI Lucknow, where I happened to be one of the founding members. And we initiated regular telehealth and tele-educational services with the postgraduate students of medical colleges of Odisha. Limiting factor at that point of time was mainly cost of infrastructure, some regulatory issues. So that's why telemedicine remained nascent for many, many years. There were a few technological advanced countries like US, Australia, Canada, which have sparse populations spread over large geographical isolated areas, and it's literally there that telemedicine became more popular, and I had the opportunity to work in at least 2 of these countries where we did telehealth clinics. In India, there is no previous experience in telenephrology, so I'll share with you what we did. This is some of the international experience from Australia, Canada, USA, and notably there was a very high patient satisfaction rate in all these studies. So when the COVID came to help things, the Medical Council of India provided legal sanction, and healthcare companies also made teleconsultation reimbursable. So this was a big catalyst. The widespread smartphone penetration in our country made it possible to deliver consultation through cell phone based applications. And data from Practo in the first 3 months showed that 50 million Indians accessed healthcare. There was a 500% increase in e-consults, and 80% of all telemedicine users were doing it for the first time. This is a survey we did on one of the popular platforms, and 71% of the physicians were using telemedicine in their practice. This is our work on telemedicine, which we did during the lockdown period between 23rd March to 31st May, when the country was in a complete lockdown. We used electronic medical records, and to cut costs, we used a combination of WhatsApp and a EMR database, because WhatsApp was very user friendly. And the data was entered in the EMR, and patients were also asked to rate their experience on a scale of 0 to 10. 477 e-consults were done. 11 of them were for international patients. 271 were from India, as I said. Both children and adults were looked at. When we asked them for their consent, I think there was only one patient who refused because he was not much technology friendly, but other than that, everyone opted in. We could, by the help of telemedicine, we could select those patients who required admission, and those who could be followed at home, and those who were advised for a review in the outpatient department. So these are the top 5 reasons to consider telemedicine: better access, cost effective, convenience, millennial demand, and reduced absenteeism. And again, it's time saving. It's a win-win for both the doctors as well as the patients. It avoids the risk of infections, especially during the COVID pandemic. And very important for our immunocompromised patients, for our transplant patients who were at risk for COVID infection. So they got the treatment from the benefits of their and the safety of their home. So these are different methods. Even an audio call is a telemedicine. You could use a text on WhatsApp, and you could use a hybrid. You could use an electronic medical record with either a Microsoft Teams or a WhatsApp, which is what we did. There are formal telemedicine platforms, but they are complex and require a lot of training and resources at both ends. And these are the benefits for doctors: increased earnings, new patients, better clinical outcomes, enhanced patient satisfaction. For patients, there is better access, there is reduced cost. Sometimes they spend more on the travel and also the time than on your actual consultation. There is better health, early diagnosis, easier compliance is also better. They would rather follow up every monthly also from the comfort of their home. So it's a win-win for both. And this is how, this is a study which was published looking at how the telemedicine is transforming healthcare, and 90% of all health leaders are developing and implementing telemedicine technology. 64% telemedicine programs offer remote monitoring, and Dr. Vinita just shared with you a peek into the future. And 1/3 of all employers with on-site health facilities currently offer telemedicine services. So it's coming up in a big, big way. This is some of our work. This was published in Pediatric Nephrology, looking at children with kidney diseases, because children, were the most vulnerable of the lot. They were not even vaccinated for a much, much longer time, and people were very hesitant to bring them to the hospital. And what we found was that low-cost telenephrology model using WhatsApp and email or EMR offered an effective method for providing pediatric nephrology services during the period of pandemic lockdown when access to pediatric nephrology was limited. This is a follow-up period. After the lockdown was removed, we continued. We looked at the practice of telemedicine in pediatric nephrology using the same low-cost model. This was published in Journal of IMA. And we found out that it helped in triaging patients who required detailed review, and from the parents' perspective, it was cost effective and time saving, and we have continued to use this in a big way still. This is a paper on kidney transplant patients, the role of telemedicine, which was presented at the World Congress of Nephrology 2021, and subsequently it has been published in the Indian Journal of Organ Transplantation. And even now, a lot of our patients with kidney transplants have continued to opt for telehealth care. Now, there are some pitfalls. It is time taking, so you need to set a timing duration, get some data in advance, involve your assistants in the data entry. It definitely infringes on privacy. A lot of time you'll get requests for teleconsultation at 11:30 p.m. at night, because some people are free at that point of time. Doesn't mean that they can infringe on your privacy. So you need to set your limits and tell them that telemedicine is not like an ATM, and it's not any time medicine. It has to be run like a clinic. Again, for the first consultation, it may not be the best one, because first you need to eyeball the patient to get a hang of it. But for follow-up, I think it's a great boon. Medico-legal issues are there because you are still liable to the same kind of problem. So you need to have an EMR, documentation should be there, and you need to place a disclaimer that this teleconsultation was done at the patient's request, not by you. And there obviously, you're spending time. Obviously, you need to be reimbursed. There are payment issues, but with digitalization of payments, with the UPI apps coming in, all this has transformed healthcare in a big way. So the take-home message is that telemedicine offered a viable modality for delivery of nephrology services during the lockdown period when access to healthcare was restricted. This model is valid for several developing countries where access to specialty care remains restricted because of the pandemic. And even post-pandemic, it can be replicated by physicians and other organizations to expand and improve the practice. Thank you for your attention.
Thank you so much, sir. Now I request once again Dr. Fareen Khan and Mohammad Azruddin Farki, sir, please come up on a stage and give a thanks moment. So the next category award, Iconic Healthcare Leadership Award, Head and Neck Cancer Surgeon, Dr. Tapaswini Pradhan, Senior Consultant, Indraprasth, Apollo Hospital, New Delhi. Ma'am, please come up on a stage and take award. Congratulations, ma'am. The next category, most trusted. Ma'am, I request to you, few words. It's on.
Good afternoon, everyone. At the outset, I think I would love to thank the organizers. This is the second time I'm here. The first time that I won, that was in 2021. And I've been very fortunate to have been honored once again this time. But what I see is awards are something like a rear view mirror, where you actually reflect upon your journey, which has brought you to this particular level today. I do a lot of work on prevention of head and neck. I think one of my colleagues, Nehal, you heard, head and neck cancers in India, which is the most common, is highly preventive, and it's a tobacco-induced. So for 2015 to 2018, I was running a lot of school programs where I would go and make these awareness issues, workshops with children, all pertaining to tobacco. I also have a program which runs beautifully on the Instagram and the Facebook, which is in my name, and it's called the Dr. Tapaswini's Corner. This was a program which we produced for the program called Arogyavani, which is the Prime Minister's India's first audio-visual health program, which you would soon be listening to. And this is also being taken up by WHO. And I would feel really happy if you listen to this program of mine, which runs on the Insta almost every Sunday. Thank you so much, and I really feel this is a beautiful platform to have been honored, and I feel learning is something which is you take from womb to tomb. As long as you are alive on this earth, you keep learning. Thank you so much.
Thank you so much, ma'am. The next category, most trusted Euro radiation oncologist in Delhi, Dr. Harish KP, Professor, Radiation Oncology, AIMS, New Delhi. I request you, please, sir, come up on a stage. Congratulations, sir. Sir, I request you, please share your experience with us.
First of all, let me thank Dynegy Business Solutions, the founders, and the Golden Name jury for conferring me this award. I am basically a radiation oncologist, special interest in Euro radiation oncology. And I am working as a professor at All India Institute of Medical Sciences, New Delhi. When we think of awards, it's all the more pleasant as this award came to me without any application. That gives me more of a pleasure. And let me thank the organizers again for this award. Thank you.
Thank you so much, sir. The next category, the most trusted nuclear medicine specialist in Delhi, Dr. Jaspriya Bal, Senior Consultant, Max Super Specialist Hospital, Saket, Delhi. The next category is the most trusted hip and knee surgeon in Malaysia, Dr. Vinesh. He is not. AV. Okay, we have the AVs, please.
Hi guys, I'm Vinesh Selvaratnam
First of all, I'd like to thank the respective council and jury of Golden Aim Conference and Awards for Excellence and Leadership in Healthcare for selecting me as the most trusted hip and knee surgeon in Malaysia. I feel extremely honored and privileged to receive this award. I would like to dedicate this award to my parents, my family, my previous trainers in the UK, my friends and my colleagues. I'm currently practicing as a consultant orthopedic and hip and knee surgeon in University Malaya Medical Centre in Kuala Lumpur, which is the main university hospital in Malaysia. I completed my medical schooling in Liverpool and did all my orthopedic training, including my hip and knee fellowship training in the UK. I returned to Malaysia more than 2 years ago after working and training in the UK for 18 years. Lastly, I'm sorry I couldn't make it to meet you guys in person. I hope we'll be able to meet in the near future. I hope you guys are having a great conference and award ceremony. Thank you and best wishes, and I hope I can meet you guys soon. Thank you guys. Hi guys, I'm Vinesh Selvaratnam. First of all, I'd like to
The next category, Best Professor of Cardiology in Malaysia, Dr. Hari Jnor Abdullah. Maybe he's also not here, but he sent a video. Can we have AV, please?
Ladies and gentlemen, I am deeply honored and humbled to receive the awards for Best Professor of Cardiology in Malaysia from Golden AIM Conference and Awards for Excellence and Leadership in Healthcare. This award means a lot to me and it recognizes my passion and dedication for teaching and researching in the field of cardiology. I would like to thank Golden AIM for organizing this prestigious event and for selecting me as one of the recipients. I would also like to thank my colleagues, students, mentors, and families for their constant support and encouragement throughout my career. Without them, I would not be standing here today. Cardiology is a challenging and rewarding discipline that requires constant learning and innovation. I'm proud to be part of this community and to contribute to its advancement. I hope to inspire the next generation of cardiologists to pursue excellence and leadership in their work. Thank you again for this great honor and recognition. Ladies
Thank
and
you so much,
gentlemen,
sir.
I am deeply
The next category, Iconic Healthcare Leadership Award, Pediatrician and the Pediatric Neurologist, Dr. Praveen Kumar, Consultant Pediatric and Neurologist, Sir Gangaram Hospital, New Delhi. Congratulations, sir. Sir, I request to you, please say few words or share your experience with us. Yes.
So, good afternoon, everyone. Good afternoon, everyone. I'm very thankful to the Synergy Group and the Golden Amen Award for honoring me with this prestigious award. I could see a number of people from all across the country and from abroad also getting this one. So, I am a pediatric neurologist. I deal with children who have got this brain disorders, starting from the simple like headache to the complex like seizures and epilepsy. And so we know that children by nature are trustworthy. So basically this award, and I will be dedicating it to the parents of those kids who trust their faith to look after the kids, especially the kids who are having very severe kind of like brain neurological dysfunctions in those ones. When I joined pediatric neurology maybe a decade ago, so people had the kind of thought that what is there in the neurology, because it's more of a kind of like disability and those kinds of things which is in the pediatric neurology part. But when you look at the spectrum of neurology in pediatrics, it becomes a huge, starting from the simple things like headache to the complex things like a stroke and all those parts of things. So thanks a lot again for opportunity, and this gives us back again to work more in this field and to grow further. Thanks a lot. Thank you.
Thank you so much, sir. The next category is the most iconic healthcare leadership award, pediatrician Dr. M.R.S. Rahman Kundra, pediatrician, senior child specialist, Sankar Diagnostic and Polyclinic. The next award is Iconic Healthcare Leadership Award, Vesicular and Endovascular Surgeon, Dr. Nitish. Most trusted radiation oncologist in Delhi, Dr. Anita Malik. Congratulations, ma'am. Ma'am, I request to you, please say few words.
Thank you so much. Golden Aim Awards, founders and co-founders, for recognizing my work and inviting me here. Thank you so much.
Thank you so much, ma'am. The next category is Iconic Healthcare Leadership Award, Neonatologist Dr. Shushma. The Most Trusted Healthcare Leadership Award, Gynecologist Dr. Anita Agrawal. The next category, Dynamic Healthcare Leadership Award, Critical Care Specialist Dr. Jitendra Sharma. Chief Critical Care and Chief Medical Quality. Congratulations, sir.
Thank you, organizer, for recognition and award. I have a disclosure. I am not true awardee for this award. Actual awardee are my team members. I am having 20 doctors with me, 80 nurses, and the many other supportive staff. Critical care is a teamwork. It's not an individual. So I'm really thankful for organizer to really recognize these efforts. And after practicing 25 years in the critical care, one message I just want to give to the whatever small audience, and especially for the younger doctors, those who are in the therapeutic medicines, those who are treating the patient, please treat the patient, not treat the disease, not treat the investigation, don't treat the imaging. That era is going towards the more we are having a more at risk for entering into the era, especially the modern or training and education, making, keeping this risk at a very higher level. So please learn to treat the patient rather than treat the disease only. Thank you.
Thank you so much, sir. The next category, Most Trusted Pediatric Neurologist in Delhi, Dr. Kanav Anand. Congratulations, sir. Dr. Kanav Anand from Sri Gangaram Hospital, I request to you, sir, please say few words.
Hello.
I'm Dr. Kanav Anand. I'm a pediatric nephrologist at Sir Gangaram Hospital. And I'd like to thank the Golden Aim Awards as well as jury for selecting me for this award. And it wouldn't have been better than to receive the award from Dr. Sanjeev Gulati, who is himself a president of the Indian Society of Nephrology. So basically at Gangaram Hospital, we treat patients at three heads. First is providing them with basic clinical care, comprehensive care for children with kidney disorders. Second is educating our doctors for this speciality. So ours was the first hospital to start FNB pediatric nephrology course at our center. And thirdly, we deal with preventive care. So we go out to the community, discuss and tell about the, you can say the signs and symptoms of about the kidney disorders in children, so that they can be picked up early and treated early, so that we don't have the major complications coming up like kidney failure in the future. Thank you.
Thank you so much, sir. The next category is for excellence and the leadership in education, the most inspirational Vice Chancellor Award, present to Dr. Tankeshwar Kumar, Vice Chancellor, Central University of Haryana, Mahendragarh. I request to you, sir, please come up on our stage and take awards. And congratulations, sir. Sir, I request you, please share your experience with us.
Thank you very much. The district business and Golden Aim Award jury for selecting me for this award. You know, this award you said is the most inspirational Vice Chancellor. I always try to, help my students. I take this principle that the students are the first. So if I say that my students are the first, so I directly interact with them and listen to them, solve their problem then and there. And I always try to see that university progresses and we could start the new courses as per their requirements and the country requirements. So that is what I look is very important, that for all of us, that if we are having the students, we should see that the outcome comes in the terms of that they get the employment, they are employable, as well as good citizen of the country. That the way I am working on. I am really thankful to the District Business Solution as well as the Golden Aim Awards jury for selecting me for this award. Thank you.
Thank you so much, sir. Thank you so much, sir. Few of the healthcare winner awards. Award winning not is here. MS Subi Hussain, Dr. Bharadwaj, Dr. Amitabh Yaduvanshi, Dr. Chiranjeevi Chhabra, now I request to Dr. Fareen Khan, CEO founder and CFO Golden Aim Brand Ambassador Asia GCGC. Ma'am, please come up on a stage for closing ceremony.
Thank you to all esteemed participants. It has been an honor to have you all present in our event. Your participation ensures the success of the event. Once again, I thank you everyone for all the kind support and Professor Ms. Kajal for being our wonderful host for the evening. I would like to thank to our esteemed speaker for the day, Dr. Sharad Kumar Agarwal ji, Dr. Vanita Arora ma'am, Dr. Deepak Puri ji, and Dr. Sanjeev Gulati ji for taking time from your busy schedule to be the guest speaker for our conference. Your presence and wise word helps magnifying our cause in our best possible way. Our conference is a huge success, all thanks to your enlightened word that inspires so many people today in this room. I also like to thank on behalf of other guests who have thrilled to have you as a company to exchange a few words with you. I cannot thank you enough for gracing your conference, revitalizing all our spirit to achieve more. I look forward to the next interaction soon. Wishing you all the best for the future. I'd like to thank to our presenting partner, Dinergic Business Solutions CEO, Mr. Azharuddin Farooqi, and our co-powered partner, Skill Reform Director, Mr. Chetan Khurana and Ms. Chetna Sabarwal, for sharing their kind support with the organization and the opportunity to work with them. Last but not the least, to all the participants and the award winner. Wishing you all a many congratulations and hope to invite you soon again. Thank you, everyone. Goodbye, everyone.